So why is breast very important? Now, let me tell you that one of the most neglected things in our postnatal ward, or two of the most neglected things in our postnatal ward, from an obstetrician's point of view perspective, happen to be the babies, but thankfully the neonatologist or the pediatrician looks after them eventually. But the breast of that female is often something that not a lot of people look after. In your postnatal rounds, in your ward, you might be just entering things like bilateral breasts, soft, non-tendered, non-engorged, and that the patient and that the female is lactating well enough. But you don't really, and that too often, beyond your first year of residency or into second or third year, give that much of a look to the breast. And even when you do in a hospital that has a high patient load, I've seen that there is never any consent that is taken before examining them. A lot of just residents probably just go and examine it, which is not the ideal thing to do. So, first of all, very important that whenever you're examining a breast, first of all, it is the most important thing that you have to do. A lot of women end up getting anxious on day one of the deliveries, especially primigravidas who have just delivered because they are not able to lactate that well. And because they are not able to lactate that well enough, they often end up over trying or over squeezing and they don't get it. And in a matter of haste or fearing that the baby might just be underfed, they end up often giving it mixed feeding, or rather than mixed feeding, they just directly on day one of their life just give it dilute cow's milk or buffalo's milk after listening to a lot of family people, elders, and whatever. Poor practice. Everything that I'm going to be talking about today is going to also tell you why cow's milk is never going to be a substitute for mother's milk, and how does the consistency of milk change over a period of time. So let us begin. There is another session that I've already taken earlier. So I hope you all watched that session also. I have taken it earlier. So first of all, when I look up at the breast is at a microscopic level, if I'm going to look at it, it contains a few structures. These few structures include these, if you can see, this happens to be very importantly the lobules, or you can even call it the lobes. Really, we tend to call it the lobes or lobules. The entire breast, one breast, on an average, is made up of 12 to 15 lobules. For women who have large and pendulous breasts, the number of lobules doesn't really increase. What increases is the stroma and the fat content that is present alongside or around the breast tissue or along the lobules. So that is what increases, but the total number of lobules happen to be constant, which is 12 to 15. When I go and zoom into one of the lobules or one of the lobes, at that time I see that each lobe on magnification of 40x has multiple alveoli. These alveoli are very similar to the alveoli that you will be seeing in your lungs. And just like in your lungs, you have your terminal bronchi, or you can just call it bronchioles. Similarly, these have lactiferous sinuses. These lactiferous sinuses or lactiferous ducts are the tubings or the linings that come towards the nipple, and then they give out openings. That openings are the ones from which the milk comes out. Now, if I have to just enlarge another one of the alveoli at a further level, I see that there are these myoepithelial cells. These epithelial cells are glandular epithelium, glandular columnar epithelium rather, and of course, columnar epithelium has the biggest function of secreting, but it is myoepithelium. The reason I call it myoepithelium is this entire alveoli is covered with a thin band or a thin layer of smooth muscles. These muscles, along with or because they are in the lamina propria of this columnar epithelium, that is why it is together called as a single unit of myoepithelium. Why is it necessary? Very simple, because the milk has to be ejected out. And for that ejection, or what we also call as the letdown reflex, that is initiated by oxytocin. Of course, these myoepithelial cells, just like your uterine smooth muscle cells, contain oxytocin receptors. So because of oxytocin, these are going to eject the milk out from these alveoli into the lactiferous sinuses and then the lactiferous ducts and eventually out into the mouth of the baby. So this is a very basic structure that you need to know about the breast. So this was the anatomy. What is the physiology of breast? milk production. Now, whenever I talk about the breast milk or breast glands or mammary glands, I always like to talk about the entire pregnancy as whole. So, lactation and breast bud formation, not lactation technically, breast formation is initiated. I'm not going to be into the puberty part. I'm talking about the breast development towards milk secreting glands begins right from the fifth week of gestation. It begins as early as fifth week of gestation, and that is initiated by the rise in prolactin. Now, if I have to show you the rise in prolactin, I'll be showing you a chart right now which shows how the levels of estrogen, progesterone, and prolactin differ throughout each trimester. So, if I have to just pick this up a bit, yes. Now, if you want to see this chart over here, you would see that, of course, we have three colors. The blue is estrogen, the black is progesterone, and the red is prolactin. Now, if you look at this chart, over here we begin at around -8 weeks of parturition, which I would say is around 32 weeks of gestation. So you see that if I'm going to extrapolate this, this is going to go like this. So by the time it is fifth week of pregnancy, these start increasing, all these hormones start increasing, they're rapidly rising. But around the time of delivery, I have already discussed this in reproductive physiology. Around the time of delivery, the levels of estrogen and progesterone fall down rapidly. So you can see that there is a estrogen and progesterone withdrawal, and the estrogen to absolutely comes down to nil. You can see at this level, the estrogen has almost come down, whereas progesterone comes down and maintains a steady state, which is slightly above zero. But they both suffer a significant fall, which you can see over here. But progesterone also falls initially, but what you can see is it is having multiple spikes. These spikes last for about an hour to hour and a half, and these spikes occur every time a mother breastfeeds. So every time a mother is going to breastfeed, at that point of time, the stimulation of the nipples or the areola and the nipple together by the suckling reflex is not just initiating the release of oxytocin, which will only pump out the blood, but also production of milk in these alveoli. The milk production then continues. The baby is going to breastfeed for, let's say, 15-20 minutes, but the breast production, the milk production, continues for almost an hour, hour and a half, and it gets accumulated inside the breast. So, on an average, in a day, a female produces around 600 ml on the lower side to 1.5 liters of milk in one day. So this is the amount of milk that is produced. I'm combining both the breasts, of course, that is produced by a female in one day. In the initial few days, by the way, we call it milk because it is very akin to how the cow has its own nipples and it creates milk. It technically is not a milk because mammary glands are modified sweat glands. So basically, I would say that milk that we are calling is nothing but specialized sweat which contains a lot more nutrients than your usual sweat. Your usual sweat is only going to contain about 98 to 99% of water, and the rest is going to be your electrolytes and salts. Whereas your breast milk contains a little less amount of water. Now, since I've anyway initiated this topic, I'll just show you the contents, and that contents are also going to be a direct comparison between breast milk and cow's milk. So, yeah. So over here you can see that the water content in your breast milk is not that high as much as you would see in a normal sweat. It is in human milk around 88.5%, whereas it is 2% lesser in cow's milk. So when I say this, I intend to say that cow's milk is slightly less on water content, which also means that cow's milk has a lot more osmolarity or osmolality, whatever you call it. Basically, the solute load of cow's milk is a little higher. Now, this is one of the reasons, one of the several reasons why cow's milk should not be fed, because this difference of 1.5 to 2% is significant because it increases the solute load to the fetal kidneys. And this increased solute load is not good for the fetal kidneys and can lead to renal damage, especially in preterm neonates. So this is one aspect that you have to know, that the water content of human milk is slightly higher. In fact, it is isotonic with plasma, and most of the osmolarity of the milk, of the human milk, is because of lactose. So one more thing that you can see is lactose is 6.8% over here, whereas it is only 4.8% in cow's milk. Now, when I talk about lactose, how is the lactose coming to the how is it coming to the breast milk? So you have to know that mother, when she consumes any type of food, any nutritious food, her body is going to consume glucose. It may consume sucrose, it may consume glucose, fructose, lactose if she drinks milk, whatever. Basically, some of the other form of carbohydrate is going to be consumed by her. In her bodies are going to undergo gluconeogenesis, glucogenolysis, all the processes that involve metabolism of glucose. And inside the breast, when this glucose reaches, because glucose is the final product in which carbohydrates are stored in our body. So when that glucose, I mean, they're stored as glycogen, but the usable form is glucose. So when this glucose reaches the breast, at that point of time, it gets converted to lactose. So indirectly, I wish to say that the consumption of maternal glucose increases much more during lactation, because the glucose in her body is not only going to supplement her own body's calorie needs, but also going to be converted into lactose for the production of fetal or neonatal breastfeeding. Which is why they say that a female, lactating female, has to be fed well. She has to be fed the right kind of food, because her body is actually using up everything that she consumes for the production of breast milk. You would ask me, so if there is a female who's from a poor socioeconomic background, who's not eating much, probably let's say there's some very downtrodden female who is not feeding well enough, will it affect her breast milk composition? Yes, it definitely will, but not significantly, because the breast, just like the placenta, is an opportunistic parasite. Why do I say so? It will start doing the body will start doing glycogenolysis. So in the liver, the glycogen stores are going to be broken down so that it can release glucose for the production of lactose. So in a way, the mother's body and the mother's nutrition will suffer, because it has to feed the baby. So though it may be affected, it won't be significantly affected. The breast milk won't be significantly affected, but the mother's own health is going to be affected if she is underfed and not well nourished during lactation. So in a way, I would also go the distance and saying that it is a lot more important that a female is fed even more, and rather than more, is fed better and looked after more during her lactating period, if not as much during her pregnancy as well. So lactation is, the moral of the story is, as important a phase of that female's life, not just for the baby, but for her own health, as much as pregnancy was for her. Because a lot of times after the baby is delivered, methi ladu, oh wow. Uh, yeah, so there are many products that increase the lactation. So yeah, there are several methi laddus and flax seeds. बहुत सारे हैं. Now I don't know the English names for it. I know the Marathi names, but yeah, there are few highly rich foods or superfoods, I would say, that are consumed during pregnancy or during lactation, that help in ensuring that the female herself is nourished well enough to create good quality milk. So here is the importance of lactose. Secondly, apart from lactose, there is something that is written over here, that is ash. What is this ash? So this ash primarily is going to contain calcium in it and a few other components. So when I say it contains calcium, remember that it is again the maternal calcium that is going to be sent to the fetus. And where is the maternal calcium going to come? Of course, from her diet, it is going to come. Also, vitamin D is going to be from her own diet. But for that, you need to know that if there is a female who doesn't consume enough of calcium, or if she doesn't consume calcium supplements, also calcium supplements are an important thing or an important drug that have to be supplement that have to be given during lactating period. But if she doesn't do that, there always is physiological enlargement of parathyroid gland during her third trimester, late third trimester, and during lactation, so that the breast milk can be prepared, which is going to be high on calcium. So parathormone is something that decalcifies the maternal bones. It pulls out calcium from the maternal bones, though that is not going to lead to something like osteopenia or osteoporosis, but it is going to significantly decalcify her bones, and that is going to be pulled out and is going to be sent to the breast milk. So ash contains a lot more calcium, And again, over here, you can see that the content is only 0.2, whereas in cow's milk, the calcium content is too high. So again, too high calcium content is also not going to be a great thing for the fetus because it can again lead to high solute load. So in ideal proportions, it is present in the maternal milk. Apart from that, fat and everything is fairly similar, so not much of difference that is present.